Here's the addendum: degrees of severity, stages of healing, impairment classification due to the pain disorders, 5th edition AMA guides. I just list the source. That's the source. You don't have this. You don't have this. Stages of trauma healing, and I just put acute, includes the inflammatory components of healing, subacute includes the repair phase of healing, chronic includes the components of the remodel phase of healing. So when you're thinking of acute, subacute, and chronic, that's a good parallel to think of it as, the components of those phases. Severity is described with the use of one or a combination of two of the following adjectives. Severity scale is 0 to 10, 0, no pain at all, 10, worst pain ever. That's their perception. What's the worst pain ever? That's like one doctor asked me, well, I said, well, what if it was, describe it as if it was a hot poker in your liver. No, that's your perception, hot poker in your liver. No, so the description is worst pain ever. It's relative to them. I always say this all the time. How many times you guys had this happen? You walk in the room and it's a little old lady with neck pain and it's a pretty severe problem, and she's got a real high threshold. She's like taking it like a champ, you know, you're going through everything. And then you got this big burly guy come in and he talks about his problem and you touch him and he's screaming. See, it's all relative. It's all relative to that person, not to you. It's not subjective to you, it's subjective to them. So it's worse to them. This is the legend for mild, moderate, moderately severe, and severe. Pain severity, based on a combination of intensity and frequency, is mild. See, intensity and frequency is a component of it. Individual pain is mildly aggravated by performing ADLs, is able to perform them with few modifications. Mild. That corresponds with the functional capacity grading scale, doesn't it? What grade is that in the functional capacity grading scale? 1. They can do it, but it's painful, right? Individual pain is mildly aggravated by performing ADLs, is able to perform them with few modifications. Individual demonstrates no or only minimal emotional distress in response to their pain, demonstrates no or only minimal emotional distress. Individual is not receiving treatment for pain on a regular basis. That's mild. So if they were coming into your office on a regular basis for pain management, can you classify them as mild now? No. That says they're not getting treatment on a regular basis. So if they're getting treatment on a regular basis, 3 times a week, once a week, or once a week, they're not mild. Based on what? The AMA guides. How much more credibility do I have now when I say moderate, when I put down moderate and they're not mild? And it's based on the AMA guides. It's based on, well, they're seeking care. They're coming in here once a week. It's regular periodic care they're getting, so they're not mild. This might be helpful, guys? It might be helpful to put moderate down a little bit more than what you think moderate is. And it's defined by your opinion? No. Chiropractic's opinion? No. It's defined by who? The 5th edition of the AMA guides. Okay? So how much more can you probably put moderate down than what you're doing? A lot more. A lot more. Because I know what you know, like me, I remember, because we think differently, right? We're not injured. We're the doctors. So I would always downplay it than what it really is. Well, not according to the definition. Like there's so many patients I'd put mild that weren't mild because they were seeking regular care. I'm like, no, they're not mild. And it kind of makes sense, right? If you're seeking regular care, is that mild? Is that something that you don't really care about? It's no big deal? No, you're seeking regular care. Okay? These will be emailed out to you. Except him. Moderate. Pain severity based on a combination of intensity and frequency is moderate. Individual has moderate difficulty in managing ADLs, must make significant modifications in or to perform them. That should say to perform them. Individual demonstrates mild to moderate affective distress in relationship to his or her pain. Individual requires, moderate affective distress. Some of those other factors were distress patterns, weren't they? Grimacing? What did I tell you about when you do orthopedic exams? Look at them. Make a note. Are they grimacing? Are they protecting themselves? Those are observable pain patterns.
Would we note that they grimace?
Yes. Individual demonstrates significant pain. And I tell you what I would do. This should just go in your notes. I would just have, when you're like next to your test and all that, just wherever you have your test, whether it's in a computer or paper or whatever, just put in there the observable pain patterns. Just put them right there and put a check next to it. Did they have it or not have it? In association with that maneuver or test. Did they have it? Did they not have it? That's all. Because it's way more often than what you're documenting. You know, I know that because I trained a lot of doctors and they never looked at the patient while they were doing the test. I'm telling you, it was crazy. My doctors would do the cervical test and they're like this. The patient's here and they're going. I'm like, they're down here. They're down here. It's crazy. You'd be surprised. You'd be surprised. You probably are doing it and don't even know you're doing it. You don't even know you're not looking at the patient.
You know, I've always had in my office is a mirror. And then when they're facing the mirror, that you can see it while you're doing the test too.
That's another topic. So, individual demonstrates individual requires ongoing medical monitoring, is taking medication much of the time. How many fit into that category? How many of your patients, medication includes over the counter, how many of your patients are regularly taking pain pills, muscle relaxers, and non-steroidal anti-inflammatories? So if they're seeking regular care or getting periodic regular medication, they're automatically in what category? They're in moderate. They're already, which means you can't drop them down to what? Mild. You can't drop them down to mild.
Is there a certain number of these that are acceptable, or just has to be one of each?
No, any of them. Any of them. Yeah. Individual demonstrates significant pain-related limitations on physical exam. Relatively few pain behaviors appear during the examination as they are indeterminate appropriateness. Relatively few pain behaviors appear during the exam. So moderate fits a pretty big category, way more than what you're probably doing. Moderate severe, pain is present most of the time and may reach an intensity of 9 out of 10. Individual can perform ADL only with substantial modifications, unable to perform many routine activities. Well, what are the routine activities? Work, bathing, showering, sleeping, cooking, cleaning, laundry, house maintenance, gardening, landscaping. Those are routine activities. How many of your patients can do all of those activities on a scale of 0 to 10, 0? None of your patients, because if it was fit that category, they're not a patient.
Right.
They're living life. They're not spending time or money coming to see you. Individual demonstrates, okay, individual receives medication to control pain on a maintenance basis. How many people, if they're just on any type of medication, now fit into moderately severe?
More.
Just because they're taking regular medication on a regular basis. How much more should you be maybe using moderately severe? How much more should you maybe using moderately severe longer into the diagnosis protocol after each re-exam? You get my point? Okay. On physical examination, demonstrate severe pain, related limitations that may make the examination difficult to perform and results difficult to interpret. A number of pain behaviors are observed during the examination and may appear to be congruent with organ dysfunction. Organ dysfunction is what? It's not just the liver. What else is organ dysfunction? Your organ systems, neuromusculoskeletal, yeah, organ system. So, congruent with organ dysfunction, number of pain behaviors. So what are some pain behaviors? This, guarding, right? So, I mean, if you have a patient who's grimacing, guarding, or on medication, they automatically qualify for what? Moderately severe.
Does that include over-the-counter medication?
Yes.
You read into it what I just read. It says medication.
I would say
Yeah. Yeah. It's over the counter, natural and normal? No, it's synthetic.
It's medication.
Yeah. Severe. Pain is essentially continuous with intensity reaching 9 out of 10 at worst. Individual must either get help from others for many ADL or spend an inordinate amount of time accomplishing them. How many times does that apply? Spend more time accomplishing them. I'm like that now. I got problems right now that are severe. I'm like, man, it takes me a little longer to put my shoe on and tie my shoe. And I got to modify my behavior to put it on. You know what I mean? Individual must either get help from others or many ADL or spend an inappropriate amount of time accomplishing them. Individual demonstrates severe affective distress in relation to his or her pain and communicates the perception of that pain is completely, that's not too big, we won't see that much. Individuals receiving maximal pharmacological support for his or her pain on an ongoing basis. If they're getting prescriptions, they're severe. If they're under prescriptions, they're severe. Because is it normal to get prescriptions? No. So how many more of your diagnoses should probably be ratcheted up a notch and probably stay longer a notch?
They were downplaying it.
Okay. Okay. And this is your source. Does this get included into your narrative report?
Yeah.
Yes. Under what? An addendum. It's a legend. It's an addendum for legend. That's how it works. Pretty straightforward.
Well, if somebody was doing stretches every morning, like you have patients that do stretches every morning, so they don't have pain throughout the day. So that would be the same thing.
That's right. They have to do that to prevent the pain. Now, they have to do an activity to prevent that. So, yes. Yeah. Remember, we're talking about normal. Is that behavior normal? Would that be, if they were totally normal, would they have to do that? No. If they were totally normal, would they have to take NSAIDs? No. If they were totally normal, would they have to take medication? No. See, compared to normal. Okay. Physical exam. So some of these are more obvious and not applicable, but some of these fit right into the definition. Physical examination is virtually impossible to perform because the individual is intolerant of many examination maneuvers. A significant number of pain behaviors are observed during the examination, and they appear to be congruent with organ dysfunctions. Now, we probably associate that with severe. The first sentence there. That's probably what most of us would say is severe. But look how many, based on the definition of the AMA guides, look how many of your other problems are severe because the patient is altering their behavior, they're taking medications routinely and regularly.